I'm Stephanie Ihnow. I'm from the University of Florida in Gainesville. I'm a pediatric orthopedic surgeon, and I'm excited to be here with Dr. Suken Shah, incoming president of the Scoliosis Research Society, here with the Scoliosis Dialogues podcast. I don't know if you want to introduce yourself, and we'll get started asking you a bunch of questions.
Thank you, Stephanie. It's a pleasure to be here. And I would start by saying my name is Suken Shah. I'm from Wilmington, Delaware. I practice pediatric orthopedic surgery and spine surgery and at Nemours Children's Hospital. And I've been there for almost 25 years.
Wow. That's great. So can you tell us a little bit about who you are, where you're from, and then kind of tell us about your whole entire life history in 3 minutes?
Well, I was born in Philadelphia, and I've stayed on the East Coast most of my life. I went to college and med school in the area, and I became interested in orthopedics sort of serendipitously. I went to medical school thinking I would be a CT surgeon. And after the first year, I received a scholarship for summer research project. And there were two competing labs. One was an orthopedic lab. The other was a CT surgery lab where they were doing this really cool stuff, like putting latissimus dorsi muscle on cardiac muscle in goats and revascularizing. And I thought that was great. But I had the orthopedic interview first. And Dr. Rocky Twan, who's still at the NIH now, gave me the job on the spot. So I had an important decision to make. Bird in the hand or go to the next interview, which I knew was going to be really competitive. I took the ortho job.
Okay.
And I met orthopedic residents who were in the lab. I met researchers who were engaged in orthopedics, and I was hooked. They were happy. They were great role models, and it was a really successful summer for me. I later came to find out that most people doing CT surgery, especially in adults, are miserable, and the training is much harder. And so you look back at pivotal decisions that you don't know how important they might be later in life. And I would say that that was a path that I'm very happy turned out well.
Very serendipitous, but it sounds like it was in your best interest in the end.
Absolutely.
Very good. So, so where you gave us about a little bit of your training, who were some of your early mentors?
Early mentors. I'm a pediatric orthopedic surgeon because of Peter Pizzatilla. He was at Jefferson at the time I was a resident, and the program at Jefferson is fantastic. You're exposed to everything in orthopedics, total joint replacement, sports, spine surgery is very strong. But what Dr. Pizzatilla was doing with kids was really interesting to me. And then I did a rotation more formally at Alfred I. DuPont Institute at the time, which is now Nemours. And that really was formative for me to pursue a fellowship in pediatric orthopedic surgery. I was interested in everything. Peds really got me hooked by the time I was a PGY 3 or 4, but Peter Pizzatilla was my early mentor. In addition to Dick Rothman, who was the chairman at the time, taught us about excellence, and Alex Vaccaro and Todd Albert, who I'm sure you've heard of, were my spine mentors and have taken great care of me even to this day in terms of sponsorship, allyship, and mentorship. Outside of Jefferson, I would have to say that my next few bosses, like Richard Bowen and Will McKenzie, have been fantastic mentors for me. Richard showed us the value of work ethic and being completely devoted to the care of children as a mission or purpose in life. And Will McKenzie taught me a lot about how to conduct yourself and how to be a leader. And his style is very eyes on, hands off, and gave me a lot of autonomy and mastery. So I'm forever grateful for that. I think it's also important to have external mentors. Randy Betts and Paul Sponseller, respectively, north and south of me in Wilmington, took great care of me. You can imagine that they were giants in the field, and second opinions were up and down 95 constantly. They were very supportive of me when I was younger, got me involved in the harm study group, and again, to this day, are very supportive. And I cannot leave this conversation without mentioning Peter Newton, who has done a tremendous amount for me, our field, the harm study group, and I owe a debt of gratitude to him.
So when did you get involved more so with the Scoliosis Research Society and kind of start your focus in spine?
Most people don't know that you can actually join the society as a candidate member, even as a fellow. It is not, I think a common misconception is you need to be board certified. You actually can be board eligible and you can apply your fellowship year. We encourage all of our fellows to apply. I think all fellowship directors should encourage their fellows to apply at that very engaging, formative period of their life. So I was a candidate member in 2001. I've been active in society for more than 20 years. Obviously, my mentors supported me. I got some very early exposure on the podium with the research we were doing. And then I got on the board through an initiative of Larry Lenke. Larry had the foresight to engage younger members on the board. And he established a position where you had to be less than 45 years old as a stipulation or a prerequisite for the position. I got on the board through that loophole when Rick McCarthy was the nominating committee chair. And it was fantastic to be exposed to the inner workings of the society. And that's when I really became engaged in the leadership in the society. And as you know, certain things are prerequisites to the next thing and to the next thing. So getting on the board at an early age was a great step forward in getting more and more involved in society.
So you have a big year coming up as SRS president. What advice have you received from some of the past members of the presidential line that you feel is going to be most valuable and help you?
Well, you can imagine that the past presidents are a very engaged group of men and women. You get a lot of advice, solicited and unsolicited. And I'm very careful to listen to the elders because they share a common purpose that we want this society to thrive and do the important work that is so vital to patients with spinal deformity and to carry out the mission. So many folks have said it's a very difficult, hard job. It's a big job, but it's very fulfilling, and I found that to be true already. I think you need an organizational structure in place to manage your time and your other responsibilities. Obviously, we all have day jobs.
Mm-hmm.
I continue to be inspired by the enthusiasm and engagement with truly a volunteer network of people that are giving of their time and energy when they could be doing something else, frankly. The staff has been awesome. I think we can only do what we do with the support of the SRS staff under Ashton's leadership. But the advice in general has been what you would expect. Do the work, stay involved, delegate properly, trust and verify, and it'll be a great ride.
So what are some of your big goals, or what are you most excited about this year as SRS president?
I would say that we have some really important initiatives. And if you like, we can sort of talk about that. I think that our future as a society depends on our members, depends on our educational mission, our communication mission, and our middle name, our research mission. We have really talented people on the board in terms of council chairs who will oversee the committees, and that's really where the work is getting done. So we have charges or tasks that we'd like the committees to work on, and they're all arranged in several different themes under those missions. We also have to think about our future and who we collaborate with. There's a lot of spine content going around. There's a lot of meetings. There's a growing number of neurosurgeons doing spinal research. There's a lot of new technology, enabling technology. We just had this great symposium on AI. So who do we partner with? Should we have a structure by which we evaluate those partners? And how do we make this a very collaborative relationship? We've also taken a very proactive posture with our industry partners. They're very important to our success financially. And we need to be engaged with them, understand what they would like from our membership. And we would like to give them what they need to succeed with our organization as well. And then thirdly, are we providing value to our membership? Obviously, we have our meetings, we have podcasts, we have some webinars, we have the journal. We're providing a lot of education. Is that what our members need? If not, what else do our members need? And we want to address those concerns. We have an important strategic planning meeting coming up in the spring, where we will set the agenda beforehand, have some pre-work, but really get into the weeds about where we want to be now and in 5 years, 10 years. And those strategic planning meetings in the past have paid off brilliantly in terms of setting goals and achieving those outcomes.
So you brought up a lot of topics right there and a lot of points. I have a lot of follow-up questions for those. First of all, the committees, I mean, I don't think people understand how many committees there really are in the Scoliosis Research Society. Of all the ones that you have served on in the past, what was your favorite committee?
Education. I feel I provide a lot of value in terms of education, and the education committee allows you to be involved in the planning of everything from the annual meeting to IMAST to webinars and different courses even. So I've learned a lot from that process, and that also gave me the skills to do a good job as Education Council Chair, which then oversees committees like Program and IMAST and Education and CME and so forth. So I really loved doing it, and I love paying that forward, and I love being involved even to this day. Yesterday at committee day, I attended Program, I attended Education, I attended IMAST just to see if I could still offer any value in terms of advice or counsel.
And then on the side of artificial intelligence, it is a really big thing. And yeah, we've had a lot of talks about it already so far in just the less than 24 hours that this meeting has been going on. But what do you see as the best current roles for AI in our practice, and where do you think we should focus our future endeavors?
Well, there's a lot there. It's here and now, and it will be forever in the future. I think the simple things like predictive analyses and automated measurement of X-rays and predicting risk factors on the risk factor calculator, all that, we're using that now, right? Generative AI, where we now have a plan for that patient customized by the machine learning, looking at a cluster of those similar patients and then prescribing a treatment plan is going to be great. So that's a decision-making tool. And then when we do agentic or more generative AI, where it's actually helping us execute the treatment and taking enabling technologies to the next level, where we can possess almost superhuman qualities and do things that we've never done before with a complication profile that's going to be much safer.
That's really important about keeping our mind on safety and our focus on safety with all the AI and enabling technologies that we have.
And there are serious ethical concerns too. I think that was brought up in the last few minutes of the symposium, where we are signed on to accept these things as truth. Some of these agents are going to be mimicking humans, and that's where it gets really tricky.
So you talked about the strategic planning meeting that you're having in the spring. So where do you see the SRS in the next 5 to 10 years in regards to research, education, and advocacy?
Well, true to our mission, we want to be the go-to place for all things spinal deformity: education, research, communication, advocacy. It's hard to satisfy all those missions. I would say that in research, we're doing a fantastic job. We have a really robust research portfolio from grants that come in from various members and investigators. But where we've been very successful to date are with 2 directed research proposals, where the Research Task Force and Research Council set the agenda. What are the necessary questions that we need answered for our patients? Long-term follow-up, a proper assessment or outcomes tool for adult spinal deformity. Those are the 2 directed research proposals that have been met with tremendous success, where very talented investigators have assembled a multi-center cohort and are underway on both of these trials now, where we can gain the essential knowledge for our patients. Education, we've done a great job, but now there are different methods of delivering that education. Where do we go digitally? Where do we go with interactive education? How can we customize the learner's pathway at the annual meeting so that they can take the best back to their patients? It's not just important for CME, but it's important for what you're going to do when you go back to work on Monday.
Very good. So, yeah, we're here in Charlotte this year. Next year, the annual meeting's in Sydney, Australia. Can you talk to us a little bit about the meeting, the vision, and what you're excited about next year?
Well, you can imagine the meeting in Sydney, we're really excited about. Many people have dreamt about going to Australia, and I hope that all the members consider coming to the annual meeting next October in Sydney. The theme for that meeting is going to be bridges and transitions, and I would say that's sort of the theme for this next year as president. And it has some very literal and figurative meanings. Obviously, the meeting is going to be right in Sydney Harbor. So you'll be looking at the Sydney Harbor Bridge, and you take a short walk after that, and you'll see this magnificent, iconic opera house. And all of our promotional material involves those two structures. But bridges and transitions also have a figurative meaning in terms of who do we bridge and collaborate with in terms of other societies, Eurospine, the Joint Section for Neurosurgery meeting, POSNA, all of these other societies. I think we can help each other in terms of spinal education and research. So that's one bridge. The other is the transitions part. All of us are transitioning through our career. We were trainees, we were early career, mid-career. Now we're transitioning perhaps into another phase as you think about, not being a surgeon anymore. Are you a consultant? Are you a leader? Are you an administrator? I think we want to provide education in all of those different pathways. And the other literal thing about transitions are transition zones of the spine: occipitocervical, cervical-thoracic, thoracolumbar, lumbosacral. That's really where all the action is happening, right? Well, I've charged the education committee with organizing that as a theme in terms of our education. How do we handle the complications? How do we prevent the complications? And how do we best equip our membership with dealing with those pathologies? So I'm super excited about that as a theme, and we will use that in the programming, in the education, in the promotional materials. And I think as I've sort of talked to people about this, I think it's something that people can get behind. And I want to invite everybody to the annual meeting in Sydney, Australia, next October 2026.
If that doesn't motivate you to get your research done in the next few months, I don't know what else will. So I'd like you just, last question is, can you just, summarize in one sentence what your motto is for this next year?
Well, I would go back to bridges and transitions. We're going to use the strategic planning meeting to figure out that bridge to the next 5 years. What are the transition points? Educationally, we talked about those various transitions, and I'm living it, right? I've been involved with this organization for more than 2 decades. I've been a practicing pediatric spine surgeon for a little bit longer than that. What am I going to do next? What should I be thinking about now to have success in 5 or 10 years? And I'm not the only one that shares that concern or anxiety. And I want to equip everybody, from the early learner all the way to someone who is looking at retirement, to be the best version of themselves.
Well, thank you so much. This was awesome. I learned a lot actually just sitting here listening to you for the last 15 minutes. And I appreciate you taking your time, and good luck.
Thank you, Stephanie. I think you're a very adept interviewer and made this very easy.
Thanks.